So effectively, how long are we away from the man in the street or the woman in the street calling to the doctor and getting it done, or calling to the hospital and getting it done?
Right now.
Right now?
You can go right now. You can actually ask about this therapy. The therapies have been available in Europe and Japan for many years. We have some good experience with it. It is effective therapy. The beauty of this therapy, there are no side effects. Non-steroidal anti-inflammatory drugs, the mainstay of therapy for osteoarthritis, high risk, lots of press, more in the recent press, that this might not be a very safe therapy for any patient, and particularly the patients we're talking about are those with arthritis over age 65. Lots of other health problems, puts them at risk. We want to minimize the risk, and this is the therapy that can do it.
How long or how often does one need to receive an injection?
This is another beautiful part of this therapy as well. It's 3 injections separated by a week, very painless, and this may last up to 6 months or even longer in most patients. So you're talking about having a very low side effect profile administration over 3 periods, 3 weeks, and it might last up to 6 months.
As against people, you mentioned earlier on that a lot of people don't go to the doctor. What they do, they tend to do here, and I know some cases, they take anti-inflammatories. Some people take them like they're Smarties, and they're not actually aware, yes, it's an instant hit and it relieves the pain, and then when the pain comes back, you take another one. But they're not actually aware of the long-term damage that anti-inflammatories can do to your system. Can you explain the damage?
Well, this is a very key point. We know that non-steroidal anti-inflammatories or anti-inflammatories that are available over the counter can disrupt the stomach. You can have a result in bleeds in the stomach, and these can be quite catastrophic. The newer medications that were introduced, the COX-2 inhibitors, were supposed to be safer for the stomach, but now we're finding out they may not be safe for your heart. So they may increase the risk of heart attack and stroke. So these are not good things. What we know about these therapies as well is they may be effective in reducing pain, but they do absolutely nothing for your arthritis. This new therapy, this joint replacement therapy, actually modifies what's going on in the joint. It works with the disease. It modifies the disease to allow patients to move better, to be able to go about their life with less pain.
So, and long-term, then, are we getting away from the need for joint replacement?
Well, what we found in some studies, very preliminary studies, is that patients who've been on the elective list for joint replacement therapy, when they've been given this therapy or the injectable therapy, they've been able to delay the onset of when they needed to have their joint replacement done. We don't know enough yet as to how long that might prolong the period without a knee or joint replacement, but what we do know is that with so many patients on the list for these replacement joints, the long time that they're having to wait, we need something in the interim to allow them to work better, to function better, and have less pain.
Finally, doctor, is the treatment expensive?
Not expensive. It's available on the GMS as far as I know, and the DPS, these are 2 terms that I'm becoming more aware of, so it's available to anyone.
Excellent stuff. Thanks for joining us this morning, Dr. J. Patel, there, new breakthrough for arthritis stuff for us. Now, let's take a break. We'll see you back here in a few minutes.